Welcome to week 36 of the Kid and Parent Pregnancy Show. I'm Asha. Your baby is getting ready to come out of the womb. Baby may move further down into the pelvis. This is called lightening. In today's show, we will discuss lightening, how to handle pain during labor, and what are the popular pain relief methods. Changes taking place in mother. You may go into labor any time from this stage. So, it is a good choice to consider packing your hospital bag and ask your spouse to keep the car refilled. You may have to increase your daily food intake to 2,400 calories from this week on to ensure the birth of a sound and a healthy baby. Your doctor will monitor you for polyhydramnios. A balance is maintained by the baby inside the womb as he swallows amniotic fluid and passes it as urine. If this balance is upset in any way, you may experience polyhydramnios. Tip of the week. You are coming to the end of a waiting game. Relax and make the best use of time by reading the book or watching the movie you had been intending to but couldn't. How is baby doing? He continues to gain weight like the previous weeks. The bones of your baby's skull starts overlapping each other when his head is inside your pelvis. This overlap is called molding and helps the baby to pass through the birth canal safely. Lightening. Lightening is a process where the baby moves further down the birth canal. Although pressure from your lungs are released and you can breathe easier, you may find walking more difficult as the baby has come down now. What is lightening? Lightening is the indicator that you may go into labor any time now. This is the sign that the baby has dropped into the pelvis and is getting ready to face the world. Although this is not the sign of labor, in every woman lightening occurs at different time as every pregnancy is unique. It is considered normal to have lightening before 4 weeks of due date, but if you feel it much earlier, you should consult your doctor. Question of the week. I'm really scared of delivery. Will it be too painful? Will I be able to cope? Well, pain during labor is intense, but you are just as strong as every other woman and will be able to bear it. It is a few times more than your menstrual cramps, and the degree differs for every woman. Do not worry about it. There are a large number of pain relief methods available today. We will try to give you a comprehensive picture of pain relief during pregnancy in this show. Pain relief during labor. Pain during labor is a concern among most pregnant women. The pain during childbirth is mainly due to the uterine muscle contractions. Other reasons for the pain are pressure on the cervix, pressure on the bladder and bowels by the baby's head, and the stretching of the birth canal and vagina. This pain occurs in various forms and differs from person to person. Some of you may feel cramps in the abdomen, groin, and back. Others might experience a tired feeling with pains throughout the body. Some women experience pain in their sides or thighs. Although the pain that you experience during labor cannot be avoided entirely, you can adopt non-medical and medical measures to provide you some relief during childbirth. Some helpful measures to achieve pain relief during childbirth are: methods of pain relief. Transcutaneous electrical nerve stimulation, also known as TENS. This equipment looks like a small radio and has electrodes on either end. These electrodes are placed on particular parts of the body and electricity is passed through them. Signals are sent to the brain and blocks the nerve cells that induce the pain. Signals are sent to the brain and blocks the nerve signals that induce the pain. TENS is usually used during the early stages of labor. Douala. A douala is a trained person who is hired to stay with the woman during her labor. Doualas comfort the mother greatly and encourage her through the painful labor process. Remember that a douala's charge may be expensive. Gas and air. This combination of gas and air is called Entonox. This is one of the most used pain relief techniques worldwide. Although it may not relieve you of the pain fully, it helps in making the pain tolerable. You inhale deeply through the contraction. Once the pains have passed off or reduced considerably, the gas and air mask can be removed from your mouth. The main advantage of this method is that the baby is unaffected by this process. Acupuncture. If you have tried acupuncture before for any other kind of pain relief, you can try it out again for pain relief during labor. Massage, change of position, and vocal release. Changing the position or massage may help. You can make different sounds such as moaning, groaning, or screaming as a way to release your tension due to the pain. Epidural. This is a regional anesthetic. Epidural is becoming increasingly popular as they provide complete pain relief during childbirth if administered properly into a specific area near your spinal cord. An epidural blocks pain signals. Usually, an anesthetist administers the epidural into your body. Epidurals can be administered into your body anytime during labor, and the dosage is increased as required. Your baby is monitored constantly till he is born. Some side effects are severe headaches and blood pressure problems after and during birth. The labor process may also get extended. In some cases, if an epidural does not work correctly, you may feel numb when it is time to push and need help in directing them. Forceps or Wenthouse may become necessary in order to deliver the baby. Hypnosis. You can try mastering this in the early stages or get someone or a CD to play the role of a hypnotist during labor and childbirth. Birthing pool. Relaxing in warm water helps you to go without drugs during labor or for an extended period of time. You can request your hospital staff to arrange one during your labor. But make sure that the water temperature in the pool is controlled carefully. Whatever method you choose for pain relief should be discussed with your doctor and approved by her. Did you know? According to a Time magazine article published in 1945, the longest pregnancy on record is 375 days as opposed to the usual 280 days. Amazingly, the delivered baby was only 6 pounds and 15 ounces. Words of wisdom. Have a nice week with this lovely thought by Florence Kennedy. If men could get pregnant, abortion would be a sacrament.